Hi, everyone. Good morning. Good afternoon. Thank you so much for joining us.
Good morning.
Awesome.
Hey there. Good morning.
Hello, hello. Well, thank you all so much for joining us. We really appreciate it. For those of you who are not familiar, my name is India Williams. I lead operations here at ScaleHealth. I want to thank you for your participation or your interest in the ScaleHealth and CHIME Nursing Challenge. Just to kind of go over the plan of action for today. So this is our final live webinar as a part of this innovation challenge. Today, I'm super excited to have the opportunity to interview two of the participating health systems who are working with us on this innovation challenge. Today, we have online with us Rebecca Kohler. She's a CNIO at UW Health, and Adam Beck, who leads digital health at Lifebridge Health. So we have a really engaging, exciting conversation planned with those two leaders. Hopefully gather some insights for you that can inform your application to this challenge. So please, we're hoping for this to be an opportunity to have some Q&A at the end of the conversation. So as you are uncovering insights, have questions, comments, want to participate in discussion, we'll use the chat as a way to have, the founders on the call participate. And at the end of the conversation between myself, Becky, and Adam, I'll kind of circle back to those questions, and we can maybe have some of you jump off of mute and talk a little bit about what you're working on as well. So with whatever time we have left, we'll make this more of a conversational experience. But before we get started, there are a few people that I want you to meet from our internal team. So first off, I'm super thrilled to introduce you all to John Mark Green, who is the Director of Innovation at CHIME. John Mark, thank you so much for joining us. Do you want to maybe give a bit of an overview on CHIME for folks on the call who may not be familiar, and then talk a little bit about this Nursing Innovation Challenge that we're running in partnership together?
Absolutely. Thank you very much, India, for that introduction. Hello, everyone. It's nice to meet you. I'm John Mark Green. As she said, I'm Director of Innovation at CHIME. Have been, this is the beginning of my second year in that role. And before that, I was working with CHIME as an instructional design and developer. And I didn't know much about CHIME before I joined the organization. I'd never heard of CHIME. And then I found out that most people have never heard of CHIME unless they happen to be a C-suite health executive, right? So if you're a chief information officer at a hospital or healthcare system, CHIME is your professional organization. CHIME has the certification for CIOs, the Certified Healthcare Chief Information Officer certification, which is the CHCIO certification that CIOs and people who aspire to that position try to obtain to demonstrate their competency and professionalism and capacity to serve in that role. So it was kind of an eye-opening wake-up call to find out that there are like 2,800 members in the CHIME ecosystem on the provider side, and that's individuals and healthcare systems that are CHIME members that we serve as a nonprofit membership association. And we provide professional development for these folks, certifications, events that offer networking and peer-to-peer learning. And what's interesting about it is, if you think about it, the CIO, it's kind of a lonely role. Like if you're in a town that maybe has one hospital, you might be the only CIO in town, at the healthcare CIO in town. And if you think about that role and then looking for peers in that position, it can be kind of daunting. So CHIME was actually created to provide a kind of a family, a peer network of people who are in that decision-making spot in the CIO role. And of course, CIOs, the definition of a CIO has changed greatly over the last 20 years as technology has changed, as the industry has changed. Now you have chief digital officers, chief technology officers, all those different it's almost a CXIO at this point. So you've got chief nursing information officers, chief medical information officers, and chief information officers for the business. So, but all of these folks are CHIME members. And then we have associations, three different associations representing data applications, security, and IT for the direct reports to those folks. So the CISOs of the world, the chief data officers of the world, the new role of the chief AI officer. So the bottom line is, if you're talking to a CHIME member, you're talking to a healthcare decision maker. What's interesting is, in healthcare, it's tough economic times. These folks still want to innovate. They still want to talk to early stage companies, but they don't have time to do all of the um, discovery and the de-risking and the exploration. So we were trying to figure out a way to help our members, sort through all of the different solutions out there. And to make a very long story short, essentially, we identified ScaleHealth as the perfect strategic alliance partner to help us do that. And so the nursing challenge is the third challenge, where we've basically gone to our provider members and said, hey, we know you're looking for solutions. Would you like to get together and work with ScaleHealth to identify potential solutions in these various different areas? The first one we did a year ago was our patient engagement challenge. The next one was our workforce challenges challenge, looking for things related to burnout and staffing, and specifically how to keep those numbers up. And now we're back for the third challenge, which is the nursing challenge, because traditionally and unfortunately in American healthcare, the voices of nurses have been sort of underrepresented at the table. And because of how nursing is paid for in hospitals, it can often be looked at as a room cost rather than something that needs to be invested in. So we want to work with you and try to help these providers find partners that they can work with to build solutions to kind of overcome the nursing shortage and the nursing crisis that we have right now. So we're, like I said, a nonprofit association. I personally am just trying to be a resource, trying to help you understand providers and the provider marketplace to help you work better with them, trying to help providers understand startups better and how to work with them. So bridging that gap is really what we're here to do. I'm really thankful that you're able to be here today, and look forward to hearing for the discussion. And I'll kick it back over to you, India. Thank you.
Thank you, John Mark. Just to echo what he said, it's been a fantastic partnership with the CHIME team over the past year or two. It's our third challenge we're running in partnership with each other right now, and there's many more to come for the rest of the year and beyond. So looking forward to more opportunities like this. Another person I want to make sure you guys have a chance to meet, a part of the ScaleHealth team, Robert Plush. If you have not had a chance to connect with him yet, he's a great resource for my ScaleHealth founders on the call as you are participating in these challenges or engaging with the ScaleHealth team and our services and our support. Robert's a great person for you to know and connect with. So Robert, please, if you wanted to just say a few words about ScaleHealth and what we can do to support some of the folks on this call.
Awesome. Yeah, really nice to meet everybody. India, thanks for the opportunity to to jump in on this awesome webinar. So real briefly, Scale has been around for about 6 years. We're a healthcare marketplace that leverages our proprietary platform to drive a lot of the work that we do. On one side of the marketplace is healthcare systems. We do a lot of work with payers, some self-insured employers. We do some work with pharma and biotech. And then the other side of the marketplace are the startup to high growth companies. And for myself, I lead the partnership efforts. I've been here a little more than 4 years. My background's in engineering, but I've spent over 20 years commercializing technologies in healthcare. Initially, for half of my career, it's been in robotics. And then the other half, I've helped scale several companies in the digital health world, a lot of consulting and advising work. And so, any questions you guys have on on how to best position yourselves and be successful with folks that you're targeting, feel free to reach out. But again, yeah, we're totally excited about this partnership with CHIME. Excited to have Becky and Adam on the call, to help you guys and give you guys some feedback from senior leaders at prominent healthcare systems. And with that being said, I'll turn it over to India.
Awesome. Thank you, Robert, as well. With that, I have a few announcements that we want to make regarding the challenge at large, but I think we'll kind of save that towards the end of the conversation. Some really exciting questions, and just want to kind of dive into discussion here. So I'm super excited. As I said, we have both Becky and Adam here on the call with us today. Thank you both so much for being here with us and sharing your insights. Just to get us started, maybe we just do a quick round of intros. Becky, we'll start with you. Could you introduce us to your organization, your role there, anything you think would be helpful for the audience to know before we kind of jump into today's conversation?
Yeah, sure. Thank you. Thanks for having me, India, and happy really to participate in this challenge and really excited for the focus on nursing and some of the words that were spoken earlier. Just really glad for that. And for all of you who are helping us to meet some of the challenges facing nursing. So my background's obviously a nurse, and I have been at UW Health for about a year and a half. Our CNIO role is the role that I fill. It's an inaugural role at UW Health. And so I kind of grew up obviously in nursing, and then moved over into kind of the IS space when we implemented an EMR at my previous organization. And then worked in applications for a while, and then into informatics, and lead here a nursing informatics team, as well as an education optimization and support. So essentially our training and onboarding team. And then I like to say other duties as assigned, right? Just as things come up and problem solving needs to happen, partnering with IS and informatics, my colleagues, and just trying to meet the needs and the demands as we move forward to kind of really improving and bringing in new solutions to help within our healthcare institution.
Awesome. Adam?
Yeah, thank you. And like Becky, I'm very excited for this challenge as well. I am the Director of Innovation at Lifebridge Health. For those of you who don't know Lifebridge Health, we are a 5-hospital health system based in the Baltimore, Maryland area. So we have hospitals in Western Baltimore City, Western Baltimore County, and on into Western Maryland a bit. As Director of Innovation, I partner with teams like that Becky leads, the clinical informatics teams, as well as nursing out there on kind of digital health solutions and trialing and piloting digital health solutions, not only in the nursing space directly in the inpatient space, but throughout the entire organization, throughout the entire spectrum, dealing with things like patient access and engagement. But recently have done some stuff here in the direct nursing space that I hope to kind of shed some light on here. Yeah, it's exciting. Love working with startups. Love the opportunity and the energy they bring. And I love the energy surrounding these pilots and trials when we really have a good opportunity to move forward on. So thank you for having me.
Awesome. Thank you for being here. Before we jump into questions, quick reminder for everyone on the call: as insights come up, comments, questions, please use the chat and we can facilitate a Q&A towards the end of today's conversation. So yeah, we'll use that as our function for question and answer here. I'll direct my first question over to you, Becky. Could you share with us maybe some of the key challenges that your nursing staff is facing on a day-to-day basis? And in particular, what are some of the ways that UW is addressing those challenges?
Yeah, thanks. So some of them I think won't be a surprise. You probably have heard some of them before, right? But I like to think about it kind of in terms of what are our challenges in regards to patient care, so things that are specifically related to patient care. And then there's the challenges that I like to call the patient care adjacent challenges. So thinking more about those administrative tasks and things like that. So in the patient care realm, we know that the population, first of all, just nursing in general, it's a high stress role, right? You're taking care of patients and their families when essentially they're not at their best, right? They're frightened, they're a lot of times in pain, they're sick. None of us are at our best when we're sick. And now that is your job as a nurse, is to take care of people in that space. So just by nature of the position, it is something that, high stress situations, dealing with life and death scenarios, right? Just that alone can lead to burnout. So any job that does that can lead to burnout. Now you add in there kind of the state of healthcare today, right? That sounds like such a broad thing to say, but you all know what I'm talking about, right? Like demand for care is high. So whether you're in the ambulatory setting where access to care is difficult, people are trying to get into specialties and they can't. The wait lists are long, or whether you're talking about in the acute care setting, right, where you're thinking about patient flow and capacity and moving patients through our system. There's the demand for beds, like literally can be really just stressful. So those, that seems like it's a system thing, but really does affect our nurses and really about how we deliver patient care. And then in addition to that, unfortunately, nurses at an increasingly alarming rate, right? It's very alarming that they're facing violence from both patients and from visitors, from family members, and so that's their workplace, right? And that makes things difficult. Also, our patients are sicker. We like overall, when I hear and talk to my colleagues and nurses, and about the patients they're taking care of, what I took care of in a floor now looks like what I took care of in an ICU in the past. The technologies that once were more limited to the ICU or intermediate care space are now actually on our floors. And that's becoming more the standard of care. So just in general, those are, that sounds like a bleak picture. Sorry, start us off with a bleak picture. But we're gonna have to talk about solutions today too, right? And so then when we talk about the things that are adjacent to patient care, right, it's the documentation burden, right? It's the fact that our EMRs, they're fantastic. They've brought so much wonderful quality checks and things like that, reducing errors, but also it's a ton of information in there, right? There's a lot of information to sift through to understand your patient. And now you could have 5, 6 patients on a shift that you're sifting through and gathering all that information so that you can deliver good care. So not only do you need to put in a ton of information, you need to be able to consume a lot of information as well. And that's challenging. And nurses face that every single shift for multiple cases. I would also say communication is one that comes to mind as a challenge. I was shadowing a nurse recently, and she was covering actually the HUC responsibilities because we unfortunately in a lot of institutions reduced HUC. So HUC, the unit clerk. Sorry, I should be careful with my acronyms. Right. We reduced those hours when we implemented EMRs in a lot of institutions, right? And now nurses are starting to cover that responsibility. And so as I was just shadowing and watching this nurse, she got up and chased, was running here and was running there. And I finally was like, what's going on? She's like, well, we don't have a system to call that nurse who's down there. So I have to run, she's going down the hallway and tracking down her colleagues because the family member's on the phone. And so that's our communication system, right? And that's not efficient by any means, but that's the situation, right? And then, then we have, just a diversity amongst our communication. We've got pagers and we've got, some people are doing in their EMR, they're receiving messages, and other people you're paging them, and other people you're calling them, and other people are on a badge, and there's so many just diverse, and you have to know, like, how do I get a hold of this person or that person? So I go on and on, sorry, there's so many things. Just lost equipment is another one that has come up for us recently, which is kind of that strange burden, our equipment is tagged, right? And so, and we have RFID, and at the same time, it's not specific enough. And I can just tell you as a nurse, you have a piece, a pump or something, and it gets wrapped up in or set aside, and suddenly it's gone. And so our nurses are like, can you get us something that beeps, so that we can locate these things? And that, again, it's that non-patient care burden that the nurses are, it actually takes them quite a bit of time, and it's not quite an administrative burden, but it's those things that, additional tasks that I need to do to be able to just do my job on a daily basis. And just in general with technology, obviously I love technology, that's my job, like, right? But it's so pervasive, which is good, but it buzzes and it beeps, and it gets lost. And here's the thing, it almost all needs to be logged in and logged out of. And so when we think about administrative time, that's the sort of thing that we're thinking about too. So I should go into some of the solutions, because it all paints this like somewhat bleak picture, and I don't mean to do that by any means, because obviously we are working on solutions. And I think the first thing I should start with, like with UW Health, and I should say, I didn't say this in the beginning, we're the UW Wisconsin, not the UW Washington, just
Good
to
to
be clear
clarify.
about that. We're the Midwesterners, not the Westerners. So anyway, so at UW Health, I think we've done a really nice job of creating a supportive environment, right? That's where it starts, is having a place for nurses, a culture that is supportive, where nursing is prioritized. And that's, again, why I'm really excited about the work that you're doing here, because it's one of the things that we've really, and I've seen with our nursing leadership team, has really prioritized nurses being involved, nurses being at the table, advancing nursing as a practice, ensuring that we're setting up things like nurse residency program, that we have flexible scheduling for nurses, again, trying to offset that burden and those challenges, and some of that with I have a list here, like creating then that flexible scheduling, that some dynamic staffing solutions, right? Alternative methods of care, right? Remote patient monitoring, virtual nursing, things like that, how we can help in bringing in some of those things as well. And then just basic, like really providing recognition to the nurses, growth programs, professional growth programs, and then really evaluating our safety measures, and our procedures and things like that. And so, we're looking at things like workload scoring, and ensuring that we have a match between our patient population and the amount of work there, along with then our staffing, and trying to make sure that we have that balance as well. So those are all some of the things. There's more, of course, too, that we're doing, and always looking for additional opportunities to help with some of those challenges.
Fantastic. Adam, I'll go ahead and I'll ask you the same question just to get us started around just key challenges your nurse staff is facing. And I'm sure you'll probably echo many of the things that Becky has already mentioned, but if there's anything particular to the Lifebridge experience. And then kind of my follow-up question to that is, in your role as you're considering digital health tools and technologies, can you give us some insight onto what the process of integration for those tools looks like within your nursing workflows at Lifebridge, and how you're looking to improve efficiency and patient outcomes with those technologies?
Yeah, sure. Just to address your first question here, just to add on, just a couple of things that from Becky, but many of the exact same things. But I think a big challenge that the nurses are facing here, and it's probably similar at UW, is just the general staffing challenge. We have a lot of open vacant positions in the nursing positions, and because of that, we're having to backfill them with agency. We're trying to bring folks in from other floors, and so there's not a consistent staffing across the individual, for an individual unit, and then you have some folks having to do full double shifts and overtime, etc. And that just adds to the overall frustration that's occurring up on the units. And so
Sure.
And then on top of that, some of those adjacent roles that Becky kind of referred to, that they have staffing challenges as well. And when they have vacancies, sometimes they can't, or people that call out, they're unable to fill them. Then all of a sudden you've got the nurses having to do not only double duty on their own current duties, but actually starting to pick up other duties that aren't being addressed because care management's not available, or the unit clerk, or whoever it may be, the techs. All of that leads to a lot of challenges. But as far as, getting in and bringing a digital health technology to life in a nursing environment, what I've seen thus far that works really well are those solutions in which they just kind of happen naturally in the nursing workflow. It just it picks up the baton from the nurse based on what they're already doing in their system.
Mhm.
The nurse does not have to go to a separate application, log into something else, click a button or whatever it may be. It's things that are happening already within a current system they're already using right now, and making that a little bit more efficient. And to do that, that technology has to have the right integration, either with the EHR or some other ancillary service. And then you've got to have an excellent understanding of the nursing workflow, and then ensure that you've got buy-in across all levels of any individual user that's going to be impacted by that technology. And so that's been really, really key in working and bringing new technology into the space.
That's great. Becky, you made a comment earlier regarding communication. I want to circle back to that a little bit. So can we talk a bit about the role of effective communication in addressing nursing challenges? I know you kind of started on that path, so let's kind of circle back there. And then in particular, I'd love to know if there are any current digital tools that your organization is utilizing, or tools that you could that you think could be very beneficial in enhancing communication and collaboration among your nursing teams.
Yeah, communication, it's so key, right? So when we think about communication in particular, when I think of nursing, we really have to think about the entire care team, right? So, because nursing, it's just that hub, right? It sits right in the middle of, close to the patient and all of the other care team members. And so nursing just naturally is interacting with so many other disciplines. And I think that it's just really, that's, I think, the beauty and also the challenge here is because that means that it's a very diverse, and we need solutions that are considering that, some of the people, the care team, some are within the institution and some are not, and some I need to be able to contact in one way and some in another. So when we think about like communication in general, of course, communication improves our handoffs of care. It helps with reducing duplication of work, and reducing errors and things like that. But when we're really and truly talking about like communication in terms of how do I get a hold of so-and-so, I just find that we've really been challenged to find like a comprehensive solution. And that's actually one of the major initiatives that we have underway right now at UW Health. When I started about a year and a half ago, I was surprised to see we still had pagers in our system, and asked the question, why do we still have pagers? And there's a very solid use case for that and a reason why. And then we also have, we have flip phones and we have iPhones, and we have, like, I could list so many that we have, right? And the challenge then is not only for that interdisciplinary, but even within nursing, like Adam was mentioning, a lot of our units are understaffed. We're pulling people are what we call floating, right, from unit to unit. And so on one unit, they're using X, and on another unit, they're using Y. And I, as a nurse, need to understand that when I need to get a hold of so-and-so on this unit, I do this, but on this unit, I do that. And that's exactly what we want to we want to stop that, right? Like this is where like standardization helps us, right? And so we're, we're looking at our various use cases, who we need to communicate to, how they receive. I often say, what's the catcher's mitt, right? For all of these different care teams, what's their catcher's mitt? And how can the device that I have communicate to that catcher's mitt? Does it actually work? And we're currently working with various mobile devices, and I don't know that we found the perfect fit yet, unfortunately. I'd love to hear, maybe others have, maybe Adam has a solution, but it's still just a challenge for us and super high priority for us, and we're still working through that.
Great. Adam, anything to add? Have you found the perfect solution yet, or are we all still on the hunt?
No, I think we're back to it. We've got something. We do have a communication platform, and we try to use a standard communication platform across all of our care team. Is it perfect? No, not quite yet. We're hoping that the powers that be kind of make more perfect and get a little bit tighter integration with some of the other systems. From the standpoint of, even if you bring on, let's say, digital whiteboards, right? And so just ensuring that, okay, if an individual nurse is coming in saying, I'm assigned to this unit and to these set of patients, that's proliferated else, everywhere where it needs to be, to the whiteboard that's presented to the patient themselves, and also the clinician who's in the individual room, to know who's on point for the patient, to a whiteboard that might be sitting back behind the nursing station, to whatever is actually in the system that somebody may be viewing elsewhere. Maybe it's the EHR, wherever it may be, if they're not even on the unit. But it's really and looking at some of the solutions that we've kind of rolled out here, kind of a couple good examples of things that, just to make sure things are really tight from the standpoint of ensuring that things are integrated well. We've got an engagement platform from GetWell. We use it for our displays. And in that engagement platform is the ability to kind of order up and serve up specific education to the patients. Videos, basically, that might be about their condition or an upcoming procedure or whatever it may be. We needed to make sure that it was really, really easy for any providers, but nurses as well, to order the specific educational video to the patient, and then not have to actually train and educate the patient how to use the system to view the video, but also to make sure that when they viewed the video, that was actually documented on the back end in the system, so nobody had to go through there and document specifically. It's that type of integration that's kind of necessary to make things really click and adopted by nursing. We also are now piloting and trialing virtual nursing on one of our units.
Great.
And so with that, we do have the smart room technology. We have a camera in the room, but we made sure we ended up going forward with the technology that integrated with the GetWell engagement displays, so that the camera actually automatically took over those displays. Nothing needed to be done by the patients, and it's showing the view of the displaying the image of the virtual nurse on the display to the patient, and then ensuring that the nurses, in this pilot, in this trial, that the bedside nurses are very, very well what's going on. They're a partner with the virtual nurse, but they know, like, the responsibilities of the virtual nurse. So they know, okay, admission, discharge, they got it. They're going to handle that. And if they're kind of overloaded, we're going to have a right communication back and forth to ensure we're communicating well. But otherwise, they communicate well, but can operate independently, and the appropriate workload can be pulled off of the floor staff nurse. And that's really critical as well.
Absolutely. Adam, you started to touch on the point of my next conversation a bit around the adoption piece. So Becky, I'll go to you first, and then Adam, capture your thoughts if there's anything else you want to add to the conversation. just high level, considering the diversity of technical proficiency among healthcare professionals, Becky, I'd love to learn a little bit more about, we're talking a lot about tech-enabled solutions here. How do you ensure that those are effectively adopted by your nursing staff?
Yeah, thanks. So one of the things that I think is just really key, and it feels so basic, but it's actually kind of hard to do, is just in getting nurses engaged and at the table early on. So when you're in the design phase, but maybe even before that, right? When we're trying to identify what's the problems to be solved, right? Like having nurses bring those forward as opposed to we're bringing to them, here's this thing that we're going to implement, now we're going to train you how to do it, right? And so very early engagement, and just really designed so that it has the end user in mind, that is really aware of, I love shadowing, I wish I could do it more. It's one of those things that I can't um, um, uh, I can't say enough. Like, I think just watching nurses in their actual, how they're doing work and all of the things. And as Adam mentioned, like things need to integrate, both from a technical standpoint, but also from that workflow. It has to make sense within my workflow. And I think that when things do that, we have such better adoption, right? When nurses are owning the actual solution, and are part of creating that solution. I have been known to say that I shouldn't have to train something, because it should just work, right? It should be so intuitive that it works. And I know that's like, I gotta have a pie in the sky, right? Like it's like probably a gold standard for user design. But when I, pick up my phone, nothing teaches me how to use that thing, right? Like, and so when we're thinking about, digital technologies in the healthcare, like does it, like, can I turn it on and does it, like, people will get it? Like, is it intuitive, right? I feel like that's something, again, that if I don't have to take hours of a person's time to train them on how to do it, then it makes sense and it's intuitive, then the adoption is just so much better. And then I would just say lastly that it has to be the combination of both the digital or the technological solution along with the non-technological solution. Just about everything that, at least in my world, has, problems that we're trying to solve, has both here's the technical solution, also has policy and procedure and practice elements as well. And those things have to go hand in hand. Or sometimes it's, it really is like a magnet on a door or a cart that sits on the door. Like we have reminders to gown up before you go into a patient's room. Those are in our EMR. We have the alerts, we have the orders, but we also have the cart sitting outside the door. So like you see it and it's part of, and it's in our procedures, in our practice, and we're tracking those things, and so on. So
Adam, any additional comments from you in terms of how new technologies are adopted amongst your staff?
Yeah, I mean, well, right off the bat, if it's a benefit to the nurses, they're going to adopt it. But from the standpoint of just ensuring that the technical proficiency is there, we kind of almost look at our own EHR, and the usability of our own EHR is kind of the barometer. So it's sort of like, okay, nurses right now, to be able to operate as a nurse up on our floor, they have to be able to enter an order and document against an order and do certain types of documentation in our EHR. So if they can do that, they'll have the technical. That's the cap. Don't make anything more complex than that.
There you go.
Try to make it simpler, but they should be able to get whatever new technology they might need to operate with. But then it's just really truly about awareness. There's a lot of stuff in our EHR that has been built for nursing, and nursing roles and other types of roles. They just aren't used because they're not aware of it. Folks aren't aware. They kind of, certain specific things that are done all the time. And it's just really, it's really about ensuring folks they're bought in and they're aware. And it definitely is providing the benefit that they'll adopt.
Awesome. Adam, I have another question for you. So earlier you talked a little bit, you gave an example of an integrated solution supporting patient outcomes. I'd love to know from your experience if you have any specific examples around successful digital health tools that have significantly improved nurse satisfaction in any way, shape, or form.
Yeah, I mean, one thing that we're using RTLS technology as well. But we're using we haven't tagged equipment, but we do have we use Sonitor, and it's the RTLS badges for the nurses. And they actually have expressed pretty good satisfaction with them because, they don't have to turn off call bells. Once they enter the room, it automatically sends the nurses in there and it turns the call bell off of them. And it really helps kind of, helps them facilitate investigations of patient complaints as far as who's in the room and whatever it may be. It really assists with all that kind of stuff. And it's, and of course that technology is, we've got their badge and RTLS tapped into the badge, so they're not having to do anything. It takes something away, and they don't have to do anything other than wear their badge, which they should be wearing anyhow. From our pilot and our trial that we're doing with our virtual nursing, and we're hoping for some nursing satisfaction, employee satisfaction results back from the unit that we're trialing on shortly. But even anecdotally, then when we go up and we talk to the nurses and the floor staff up there, how's it going? Is it working well? They just say we love it, working really good. And unfortunately, when there's a call out on the virtual nurse staff, they feel it. They're like, darn, we're back to where we were again.
Right.
And so that's really, really key and nice to see.
Absolutely. Toward the beginning of the conversation, John Mark alluded to a previous challenge that we ran with CHIME around kind of workforce staffing solutions at large. And a part of that conversation was the topic of burnout. And I think that's something to not be ignored in this conversation either. So Becky, I'll go over to you. Can you share maybe some insights, lessons learned around initiatives aimed at preventing burnout specifically among nursing professionals?
Yeah, I have an interesting lesson learned that I recently had, even after all the years I've been in IS and informatics, and we're working on some generative AI functionality, right? Again, really looking to help with that administrative burden, in particular this solution. And I was conversing with one of our clinical directors, and I find that I was actually kind of, what's the right word? I was not quite apologizing, right? I feel like I was essentially saying like, it's going to help a little bit, right? Like it's going to help a little bit with, for some nurses, and it's going to reduce the burden, and it's going to reduce some of the cognitive burden for some people. And he stopped me, and he really just pointed out that anything that we do that helps to take off the burden is helpful and welcome, and that they really want to be able to have the opportunity to trial those things. And so, and it was my own kind of personal lesson learned, because I often am in like these big transformational type projects, right? That are like, we're going to start piloting here, and then we're going to scale up to the enterprise, and we're measuring the ROI, and we're, and things like that. And those are all great, right? We need those like macro level things. But really, when it comes to burnout, I think that it's about the individual nurses, the individual care team members. And it just reminded me how welcome and how important every little progress that we make can really help. And we still want to do the big things, those somewhat smaller things that just start to pull off a little bit of the cognitive burden here and there. And like if you can help, a handful of our nurses, we appreciate that. And so that was just kind of my like, even though it's a little thing, like a little generative AI project, that it's really is important.
Absolutely.
Now,
Adam, same to
I'll
you.
dovetail on that one because I
Yeah,
would say lesson learned here, and off of that, for an individual specific, you know, intervention to technology or innovation that you bring in, for things like, aimed at, preventing burnout. It's hard to measuring burnout and the reason for the burnout and trying to associate it directly with this one specific intervention is really hard. And it's a pretty long, trail of time needed before you can actually, pick up that measure. So you have to think about, are there other particular measures or other particular things that we can monitor that are associated with burnout that we can attribute directly to an intervention? Because it is, if you just look at employee turnover, it's going to be hard, and there's going to be a lot of reasons for employee turnover. The pay being better down the street than we are paying, that's going to kill you. And then you'll end up looking at an intervention and just say, no, it didn't impact anything. So it's a tough measure, but overall, you want to just say, okay, what do we feel like it's going to, directly impact it, in some way, shape, or form, even if it's small, and make sure you can monitor and measure that.
Adam, my final question directly towards you, in your role as leading the innovation team, how, and considering, that this call is full of innovators, how does your organization approach working with startups or innovative solutions? Is there kind of a minimum threshold or something you need to see in terms of pilots? Are you open to co-developments? Just tell me a little bit about how Lifebridge works with innovators.
Yeah, we definitely look, for folks that are willing to partner and take on risk, especially if we're trying something new, and being able to allow us to trial it and pilot it, at either, for at a low reduced cost or maybe even free for a bit, to make sure we can kind of measure it, make sure it's doing the right thing. We also have to weigh in exactly what the intervention is with the actual size of the startup and the risk we're willing to take on, right? If you go out and you do something like, hey, we're gonna go ahead and swap out the entire communication tool for our nurses. It's hard to trial that because everything is so interconnected. You have to do it almost at an enterprise-wide scale, and you have to be careful. It's huge and risky, and the switching costs are significant. So all of that has to be weighed in, and we have to look to see, exactly what the risk is involved here. If it doesn't go in the right direction, or if the startup, if they're small, given what's going on in the environment right now, if they end up having to bow out of the business 6 months, 1 year, 2 years into the trial or into the program. So all of that in place. But I would say, before we even get involved and start having discussions around an opportunity with a early stage company, we first want to make sure, is it an opportunity? Is it a new opportunity? Is it one that's not being covered or potentially could be covered by current technology on any of our current solutions that we've spent a tremendous amount of time and effort and money on in-house? So we've got to make sure that opportunity exists.
Absolutely. Well, I could keep chatting with the two of you all day, but I do want to make sure if we have anybody on the call that has any questions, that we do have an opportunity to answer those. So if anybody has something to add to conversation here, a question for Becky or Adam, raise your hand, unmute yourself, anything. Rob, yeah, go for it.
Yeah, hi. Thank you guys so much. Really interesting to hear about the current challenges. I hear burnout come out a lot and technology associated with it. Is there any focus or appetite on physical solutions? I sit on a couple nursing boards, and a lot of what we hear is there's a physicality that's involved that leads to burnout. Is there any interest, focus, appetite around that arena? Reason why I'll share that, we've developed footwear that reduces impact, that run about 50,000 healthcare professionals and facilities that have had a benefit. But I'm just curious the role of the physicality, if that's top of mind, if it's an area of emphasis, or how do you guys think about that?
I think in general, it's something that's worth considering, and if it's something that you're hearing from nurses and you think there's an opportunity, yeah, I think all things are on the table at this point. And the overall environment as a whole, a safe environment, as Becky alluded to, ensuring that if something occurs in a very dramatic fashion, whether it's a rapid response, whether it's a patient becoming violent or a family member becoming violent, that the patient's supported and safe. But in general, it's just even potentially the physical environment. Something like footwear, maybe that could help. I do challenge the startups involved in here. Please do consult nurses where you can. It's hard to actually pin into the direct bedside nurses down to try to get in and try to have a discussion around what might be an innovative approach somewhere. You're trying to find the right nurse that's willing to do that, then have another nurse just saying, well, it's the EHR and having to do this in the EHR or whatever, maybe logging in or whatever, where you're not going to be able to battle that solution. That's really hard. And just feel free, think way outside the box. Please do. Bring it way out. We got enough communication solutions. We got both Sarah, we've got Tiger, and those are all over the place. Even the smart room technology, there's a bunch of players already in that place. But I still think there's white space to be had here. So please do think way outside the box. Welcome it.
Great. Becky and Adam, I'm Peggy Plan. I'm with ComWave, and you probably couldn't tell from this side, but I've just been shouting out with you because I too am a nurse and spent many years at the bedside and then led teams that experienced all the things that you're talking about. So it's sad that it is still where we are today, but that's why we're here to help solve some of those issues. But is there a way to talk further with you? Because there's so many things that you talked about that our solution is working on. And I mean, our goal is to help with nurse burnout. And I was very happy to hear that you understand that obviously the complexity of it, and there's not one silver bullet for nurse burnout. We want to work with nurses on dealing with alarm management because, to your point, Adam, they don't necessarily articulate that because of all this noise and all this alarming, in addition to the other communication systems, we're just have so much cognitive overload.
Peggy, I highly suggest if you have not started or completed your application that you do so. Through that opportunity, John Mark is going to jump on and kind of talk about what the outcome for the challenge is in a bit as well. You'll have direct access to Adam, to Becky, and a slew of other healthcare leaders through CHIME. So we're happy to kind of make direct introductions as you kind of participate in this challenge opportunity with us.
Okay. We did fill out the application, but okay, thank you.
Great. Awesome. I want to quickly, just before we close things out, we have David who has a question as well. David from Shiftwave, go ahead.
Oh yeah, thanks. And just to piggyback off of Rob's question, we're a hardware software solution, and we've been invited to apply for other challenges like with the pediatric network and some groups. We've been, for the last 2 years, we've been doing a heck of a lot of work in Ukraine, pretty much up and down the line with their hospital system and recovery systems. And the Shiftwave system, it's a pretty profound shift in like the stress level immediately. So we're already working with a couple nursing groups in the United States, but we've found it to be very challenging there. So we've really focused more of our effort on professional sports and executive health and stuff like that to start. But this challenge is super exciting. So I'm glad to know that, that potential hardware software solutions are interesting. But my question is that for us, like the experience inside Shiftwave is profound. It's unique. And frankly, like it is pretty dramatic, but without experiencing it, it's kind of hard to like read an application or read statistics, because from my experience, is studying the landscape out there, things that de-stress and whatnot. there's a big difference between what I read in a lot of places and what's actually happening on the ground. So I'm curious if there's, any insights or, like the reason I say this is that typically what we do, no matter where you are in the world, we just get you in it, and then it really changes the conversation. So any advice on like how to essentially deal with that, like in terms of how to present this the best way, and then how to work with folks to kind of get an understanding of what's possible.
Adam, Becky, if you have any comments on that, please feel free. But David, just in general, if there's anything that we can do on the ScaleHealth side to help you understand how to best position your solution within the application, I'd love to make some intros to members of our team who can support with that generally. But
That'd be
Adam,
awesome.
Becky, if you all have any thoughts, please feel free to add as well.
I would say, and sometimes it is, and those types of solutions, sometimes it's just saying, okay, a very good description of what the actual solution is, but then it becomes a demo, right? And
Yeah.
actually being able to trial it in some way, shape, or form, and whether you can do that on your website or not. Trying to figure out the best way of doing that.
Yeah, there's an actual like chair bed that someone lays in, and then there's a whole other, component to it, and tracking and all kinds of good stuff. But it really does require being in there to I mean, we've had about 80,000 users, and no one's ever compared it to anything coming out. It's a pretty distinct experience. And the shift around like blood pressure, stress, a lot of different metrics is pretty stark too. So that's why we usually just I have presentations, I have all kinds of things, but I noticed that like our studies and a lot of other studies seem to say similar things, but the results from most people in practice is starkly different.
Sure. Completely understand. It's a great question, David. I think it's a great segue into kind of our closing of this conversation. So Adam, Becky, I want to thank you both so much for your insights and what you've shared. I know it's drastically impacted and informed our innovators' applications to the challenge, and hopefully they get the opportunity to chat more with you as this all closes out. So thank you all so much. A few quick announcements regarding the challenge. So I've just thrown in the chat now the application to join if you have not already. Just quick housekeeping items from a timeline perspective. We're just about a week out from the submission deadline, which is next Friday, April 5th at 11:59 p.m. Eastern time. So please make sure you get your applications in before then. Also want to note that we have John Mark on here, can talk a little bit more about what the outcome is for finalists and kind of the closing out of this innovation challenge. So John Mark, please feel free to talk a little bit about what the Innovation Summit will entail for those who are selected.
So yeah, I know we're just about out of time. Actually, it just clicked over to 12 o'clock Central, so I'll make this very brief. I just put a link to the Innovation Summit page, the event page, but I wanted to let you know we have sold out. So we're basically capping registrations at this point. What that means is that we're going to have upwards of 80 primarily decision maker providers at the event. And the finalists in the challenge, the two finalists will get to join the ScaleHealth team at the event to speak to those folks. But we're also trying to figure out ways to better serve the startup community in answering that question of what's the best way to approach a provider, talk to a provider, what do providers want startups to know? We've been talking with ScaleHealth about solutions for that kind of education. So we're going to be bringing that hopefully down the road, and any suggestions that you have, we'd love to hear those, and just want to try to build better bridges to make those connections more efficient and better for everybody. So good luck to everybody, and thanks for joining us. I appreciate the time, and I'll wrap it up.
Thank you, Jean Marc. And thank you everyone for joining us this afternoon. There'll be a recording of this posted onto the challenge landing page. So if you are interested in reviewing the session again, that will be available to you. And if you have any questions related to your application, any ways that ScaleHealth or the CHIME team can support you in those endeavors, please feel free to email me directly. I'm india@scalehealth.com. The rest of the ScaleHealth team is the same as well, just first name plus our domain. So I want to thank all of you so much for the time. We'll be in contact shortly, and thank you for participating in this innovation challenge. Have a good
Thanks,
rest
everyone.
of the day.
Thank you. Bye-bye.
Bye.